Today I'm going to take you through an asthma care pathway built using process mapping and automation to deliver more streamlined care and to drive efficiencies. This has been developed in collaboration with IBM and is just one of the areas of the NHS that Responsiv are currently working in. As well as focusing on clinical care pathways, Responsiv are also looking to understand and optimise process across all functions of the health service, everything from HR to finance to operations. We start here by looking at the process map for an asthma care pathway, which shows all participants and stages from booking through to treatment. The process begins with Mark, who is responsible for booking the hospital patient in. Jill Wright, who is currently on a ward, has presented as a potential asthma patient. Mark logs into the system with his user ID and password in order to begin booking an appointment for Jill. We are taken to the asthma patient dashboard, which shows details of current open cases. Mark searches for Jill Wright in the patient record system using her surname by the patient. Mark proceeds to book in the patient, selecting between ward or A&E presentment, and is able to add notes to her record giving further details of the breathing issue she is suffering from. Mark is taken back to the asthma patient dashboard where the booking is confirmed. Mark is able to log out of the system and the process passes to Caroline, who is the triage nurse. Caroline then logs into the system using her user ID and password. She is taken to the asthma patient dashboard where she can see that there is a new task to perform an initial triage on Jill Wright. There is also a date specified for when this task is due by. From the dashboard, Caroline can also see the process map, which details all the steps to be followed, which step the team are currently at, which other personnel are involved in the process, who has completed any previous tasks, and the dates of these. From this, she is guided through the alternative next steps she can take in order to provide the required care to this patient. Once triage has taken place, Caroline exits the process map and returns to the asthma patient dashboard where she launches Jill Wright's record. Again, here Caroline can also see each step of the process that has been completed and the steps taken by Mark to book the patient in. As part of the process, Caroline also receives a push notification to her mobile phone to say that Jill is overdue for triage. This helps Caroline to prioritise her tasks. Caroline then claims the task. Caroline returns to Jill's patient record where she can see the full details of what has taken place to date. Jill's triage appointment with Caroline takes place. Once Caroline has performed her triage on Jill Wright, she takes the information she now has on the patient and enters it into the system, including any additional documentation. During the appointment, Caroline took a chest x-ray and she now adds this to Jill Wright's patient record. Caroline uploads the X-ray image and will be available for all clinical staff involved in Jill's care to access when they are assessing Jill's case, along with other commentary recorded by Caroline in the patient record. From her observations, Caroline believes that the patient does have asthma but has currently diagnosed as mild. She adds details to Jill's patient record and she is then in a position to move to the next stage of the process. With Jill Wright's symptoms initially diagnosed as mild, the patient is then passed on to Vicky, the triage manager, for secondary tests and observation. Vicky logs into the system and claims the task. She reviews all of the information that has previously been recorded on the patient's asthma dashboard, including details of processes followed, who has been involved, any comments from clinicians and any other documentation. Vicky then carries out secondary tests on the patient once she's finished reviewing the tasks. Vicky measures Jill's respiratory rate, breathing condition, heart rate and peak flow rate and records the results. When the results are entered into the system, a set of rules are run as an advisor which will suggest to the clinician how severe the patient's symptoms are. In this case, Jill Wright's symptoms are indicated to be severe. However, Vicky has forgotten to record the patient's cyanosis, and when she is prompted to do so, the symptoms indicate that this is a life-threatening condition. Vicky adds her own commentary to the record and passes Jill onto the asthma nurse, Hugh, as a next stage in the process. Before Hugh has logged into the system, he immediately receives an alert to his mobile phone informing him of a life-threatening case that needs to be reviewed at once. He then logs into the system and is able to review Jill Wright's case and administer the care required based on the details in the patient record that he has access to. In this scenario, Hugh is also the team manager, so he has access to a team management dashboard. He can see his team's performance across all patient cases and is able to monitor the progress of assigned tasks, including which are still outstanding and the time frame a task has been completed in. And he is able to view on an individual basis where tasks have been completed and where tasks might be overdue. In this scenario, a number of tasks still need to be actioned, and as a manager, Hugh has the privileges to reassign to another team member if required, which helps if team members are away or there is a workload issue. As a manager, Hugh reviews the process performance dashboard where he can see a consolidated view of all patients who are within the asthma care pathway and can track activity being carried out by members of his team and the associated timeframes. This allows Hugh to identify where there may be bottlenecks in the process, and he can therefore take action to fix these. And the process map, which shows a diagrammatical view of the process, also gives Hugh an overview of all patients, all tasks and progress of these tasks. This makes it much easier for Hugh to identify where he needs to step in and remedy any issues.